One thing people often get wrong about public health history is assuming it was always rooted in humanitarian ideals. But what if I told you that in many colonies, sanitation and medical campaigns were tools, not cures, used to redraw social boundaries based on race and class? In early 20th century South Africa, cholera outbreaks weren't just met with disease prevention, they led to the forced relocation of entire black communities under the guise of containment. Streets deemed too native were bulldozed in favor of European-style districts labeled as hygienic zones. Was public health saving lives or cleansing spaces for elite comfort? British officials in colonial India introduced quarantine laws after plague outbreaks, but enforced them with disproportionate brutality. High caste residents received exceptions while working-class Indians faced extreme measures. In French Indochina, leper colonies doubled as political prisons, isolating dissent and illness together. Were these places promoting wellness or silencing bodies deemed inconvenient? Supporters argued these actions protected populations, while critics noted they reinforced white supremacy through scientific language. Even mosquito control efforts during American occupation in the Philippines divided neighborhoods along ethnic lines. Mosquito screens for officers' clubs and DDT sprays for villages created stark living conditions. Sound familiar? Today's global COVID response saw vaccine hoarding by rich nations whose historical narratives echo imperial entitlement. So the question becomes, can we trust modern medicine to be free from political bias? Can a scalpel that once drew battle lines ever promise healing without extracting accountability first? When we praise eradication campaigns, do we remember disparities they left behind and whose bodily autonomy was sacrificed? If hospitals were once fortresses of power rather than shelters for well-being, how should future systems confront their architectural ghosts? What does it mean to build equitable care when corridors were designed to separate us long before any outbreak began? Let us know your thoughts. Can we truly decolonize healthcare if its foundations remain buried beneath sanitized memories?